Okay, so prior to this treatment that's going to take place, I have removed all jewellery, put my hair up. I have also washed my hands. I've washed my hands all the way up to my elbows. I'm clear from the elbow down to ensure hygiene and to make sure my treatment goes as smoothly as possible. So before the massage, we went through a consultation form with my client. This included any questions that I may need to know the answers of, and which may help me gauge my massage that I'm going to do, or anything that's important. So such as where the pain is, how bad the pain is, any 24-hour behaviour, so how they perceive in the morning, how they perceive throughout the day, does it get worse, does it get better. I also asked any red flags, so I asked if they had any thyroid problems, heart conditions, rheumatoid arthritis, epilepsy, asthma, diabetes, or they take any steroids. As well as this, I asked if they had any contraindications that may stop me from doing massage, so cuts and bruises that I may need to know of, which was none. Any skin conditions, skin diseases such as like psoriasis or eczema that I may need to be aware of, which was no. Any undiagnosed pain that they may have, which again they didn't have any, as well as any lumps that they have found recently which haven't been diagnosed. On the consultation form, it also asked about history of the present condition, so when it started, how it started, also had they had any other physio or any other massage taking place, which they had through their rugby training. Also it asks any medications I may need to be aware of, any previous conditions they may had, which they had slight asthma when they were many years ago now, so when they were little. Any operations they may have had, which was none. It also asks about any social and family history, so if there was any conditions in the family that I may need to be aware of that may be inherited, which there wasn't any, how many times they train a week, which type of training they did, and any easing factors they may have. So yeah. Okay, so do you have high blood pressure?
No.
Osteoporosis?
No.
Cancer or previous cancers?
No.
Joint replacements?
No.
Fixed pins or plates?
No.
Unexplained weight loss?
No.
Okay. So, and where is your injury that you feel you've got?
In the hamstring.
Okay, left or right worse?
Right.
And is it pain, tightness?
Tightness.
Okay, how do you feel when you, like 24-hour behaviour, when you wake up in the morning?
A bit tight in the morning, but I'll give it a stretch.
Okay, do you have thyroid?
No.
Heart condition?
No.
Rheumatoid arthritis?
No.
Epilepsy?
No.
Asthma?
Small cause.
Diabetes?
No.
Do you take steroids?
No.
Do you have any cuts or bruises I need to know about?
No.
Any lumps that have been undiagnosed? Any undiagnosed pain?
No.
And any thin conditions?
No.
Okay, do you use any easing factors if you feel tightness?
Stretching and rolling on a foam roller.
Do you take any painkillers if needed?
Yeah, sometimes.
How many would you take?
2.
Okay, any aggravating factors, functional limitations, things you can't actually do day to day?
No.
Okay, history of present condition, when did it start?
About 2 weeks ago, during training.
Did you have to limit any training or limit?
Yeah, my physio pulled me out.
How much physio have you had?
Twice a week for 2 weeks.
Okay, do you feel that your strain or is improving, static or worsening?
Improving.
Okay, previous medical history, have you had any operations?
No operations.
You mentioned asthma early on as a low cause. Was this increase when you were younger or?
Decreased when I was younger.
Okay, do you take any medications at all?
Nothing.
Okay, so social, what type of training do you do?
Weight training and rugby training.
How many times do you do rugby training?
Twice a day on a Saturday.
And weight training at all?
3-4 times a week.
Any family history at all?
Nothing.
So before starting the massage, I did some palpations of my client on their hamstrings, which is where the client indicated they had pain and tightness. I palpated both the left and the right hamstring and found that there was more tenderness and tightness within their right hamstring. I mainly found that was more tenderness within their right semitendinosus, which is where I will focus my massage more. So the next thing we did was tested the client's range of movement. This is allowing me to see how flexible the client is and engage how tight their hamstrings are. I will do this by eyeballing through lifting the client's leg and getting them to bring it as close to their body as they can. I will also retest this at the end of the massage to see how effective my massage was. Get as close as you can to your body. Okay, so you saw we just continue. In this massage, I'm going to focus on the client's hamstrings. Within the hamstrings, you have three major muscles, which are the semimembranosus, semitendinosus, and the bicep femoris. Within the palpations earlier on, we indicated that there was more tightness and tenderness within the client's right semimembranosus. This will be my main focus of the massage. So the first technique I'm going to use is effleurage. Effleurage is used to get the client used to your touch. As well as this, it helps warm all the muscles up that you're going to be working on. It also improves blood circulation and the removal of waste products within the body. This is all done by applying an upward stroke towards the heart. So next we move on to petrissage. Petrissage is used within wringing or rolling of the muscles. This will help increase the muscle's elasticity. It will also help stretch the muscle out, relieving any tension or tightness that the client may have. As well as this, it also increases the fresh blood coming to the soft tissues and the muscles. This will then help aid the vascular and the lymphatic response of the body by removing all the waste products. So next we have tapotement. Tapotement is usually used towards the end of a massage to help the blood circulate around the body. It also helps waken up, soften and warm those underlying tissues. This is done by hacking and beating within my video. After that, we then proceed back to effleurage, which will then help again improve blood circulation around the body and get the client back down to relaxation. Okay, so we're going to move on to a massage. I'm just going to place this towel on you just so we can keep that other leg warm. Okay, and it's also going to protect your shorts. Just lift this leg up a little bit. That's it, put it down. Okay, so to start off with, we're just going to start off with some effleurage. Okay, so effleurage is just working the muscles, bringing the blood to the surface and just warming up these muscles, okay? Does that feel okay?
Yeah.
While doing effleurage, what it's going to do is it's going to flush all the lactic acid right through the body, and it's going to get rid of the toxic waste and the stuff that we don't need in our bodies, as well as warming the muscles up. Okay, I'm just going to apply slightly a bit more pressure just to keep these muscles warm, get the blood flowing. Okay, now those muscles are warm, we're going to move on to a bit of petrissage. Okay, so I'm going to start ringing and rolling the muscles. So the muscles that we are working are your bicep femoris, your semitendinosus and your semimembranosus. Okay, so petrissage is something that we use to work deeper into the muscles, and this will help lift and separate the muscles slightly and make sure that the muscles are getting something that's working into them. Okay, then we're going to go back in with a bit of effort just to keep the muscles warm, keep that blood flowing. And then go back in with some more petrissage. Okay, while we're doing this, just picking the muscle up, rolling it between our fingers and our thumbs to stretch that muscle. How's that feel?
Perfect.
Yeah. So in my video you can see that I have found a knot. This is called a trigger point myofascial release. This is done by applying direct pressure to the knot to reduce any pain or tightness within this. This is done by asking my client to take a deep breath in. I then apply pressure. When the pain starts to ease, which is indicated by my client, I will then apply more pressure to reduce and relieve any pain. So the next thing to do is a post-isometric stretching technique. Within this technique, I will take the client to their binding point of their hamstring. The hamstring is on stretch, however they're not in any pain. Once this is done, I will ask the client to apply 40% pressure right through my shoulder. They then take a deep breath in and exhale and fully relax. Once they're fully relaxed, I have a 5-second window to apply them to a new binding point. Again, they will not be in any pain, they will just be on stretch. We will then apply this 2 more times. So after the stretching technique, we again revisited the client's range of movement. The client's range of movement had improved by 20%. This was done by eyeballing again how close they could get their leg to their chest. We knew this was effective by the massage we did as well as the stretching technique we did. So after the treatment, me and my client went through aftercare. I advised that they keep hydrated through water and keeping most of their fluids up. I also advised that they may use ice if they felt they had any tightness or pain within the area to reduce the inflammatory. I also advised they use a foam roller by using one leg on the foam roller, rolling back and forth over their hamstring, doing this on both legs.